What a lovely crowd on a very cold spring night. Thank you guys so much for coming to what is our 2015 annual meeting for Howard Brown Health Center. I'm disappointed a little bit, David, that we didn't walk down. Yeah, thank you. Gone with the wind here at the Brown Elephant. My name is Duke Alden, and I am very proud to serve as chair of the board of Howard Brown. And it's been an incredible year. And I want to thank all of you for being a part of this celebration of the year, and I look forward to next year. But before we get too far into the program, I want to say some very special thank yous to a lot of people who made tonight possible. First, I want to thank our generous donors who range from large corporations, foundations, and individuals. I want to thank our volunteers and other community stakeholders. Many are here tonight. Thank you guys for being here. I also especially want to thank our Community Advisory Board and our Board of Directors. And I would ask that if you are on either organization, you would raise your hand and be recognized. These people spend a heck of a lot of time helping you out this organization. Thank you guys. I want to spend a lot of energy thanking our incredible staff. You guys know how hard you work for Howard Brown. You guys know how many hours you put in every week. You guys are the heart and soul of the organization. Thank you guys so much for all of your work. A round of applause for the incredible hard working staff of Howard Brown. And finally, I want to thank the most important group that's not only represented here tonight, but also spread across a very large part of Illinois, Michigan, Indiana, and Wisconsin. And these are our amazing patients and clients. They remind us every day of why Howard Brown exists, and it's quite simply to strengthen health and the lives of the vibrant and tenacious community that we serve. So to our patients, 27,000 strong, thank you so much for your commitment to Howard Brown. And tonight really wouldn't be possible without the support of the people who helped make tonight possible. There were people who donated the food and the drink and made other parts of this evening alive and exciting for us. And they are Illini Care Health, Gilead, Miller Coors, PepsiCo, and Roti Mediterranean Grill. Thank you guys so much for all of your support. Now, as you know, for the last 40 years, Howard Brown has been a leader in providing health care to the LGBT community. Now, each year, we serve 20,000 patients and clients and offer services ranging from primary care to behavioral health to HIV testing and treatment and other social services. We also have, as many of you know, some very targeted programs that specialize in the trans community, elder care, health care for young people, and women. The idea is to never leave anyone behind, and I am incredibly thankful for the staff for focusing on that important mission. While every year has been a pretty great one for Howard Brown, I think it's fair to say that the last 12 months have been particularly transformative for the organization. And I think that the months ahead are going to show some really exciting new changes and new initiatives for Howard Brown as well. But there is risk ahead, and it can be all too real for an organization like Howard Brown. Many of you have probably heard of Governor Rauner's proposed budget cuts, and they could impact what we do every day to the tune of $1.1 million. That could mean that 1,500 HVHC patients will be adversely affected. There will be delays or complete loss of medical care for many of them, or loss of their housing and other support services. Now, these proposed cuts will truly disrupt these patients' and clients' lives, leading to late testing, late diagnosis, and worse health outcomes. The bottom line is that it will add to the spending that this state has to put out, not subtract from it. Now, our community has too much at stake to be silent on this important issue, and that's why I ask all of you to reach out to your legislators and tell them to stand up to these budget cuts and be very specific about why you are doing so. I think if we come to that fight united, we have a much better outcome of success. But on a brighter note, I am very proud and honored to introduce our fearless leader, President and CEO of Howard Brown Health Center, Mr. David Ernesto Munar.
Thank you, Dave, for the warm introduction. Please join me in recognizing before he leaves Alden Tom Tunney, who's with us tonight. And many of our elected officials were not able to join us because of schedule and weather, but I want to thank Yoni for representing Congressman Quigley. Thank you. So thank you everyone for attending this evening. I know many of you are wondering why I brought you back here less than a year. But we had our 2014 annual meeting here in this space in May of 2014. Frankly, taking stock in the year that passed and looking forward at what's ahead is one of my favorite traditions. And as we look back at 2014, we're also reflecting on the lessons of 4 decades of community service. For me, the fundamental lesson of 40 proud years is simple but elegant. Our community grows when we focus on our health. 40 proud years for me is not just a slogan, it's a call to action. It's a reminder of what guides and motivates our work. It has been particularly relevant for me as the new CEO to understand the genome of Howard Brown Health Center, to ponder what's at our core, from where did we spring, where does our moral compass point as we map the organization's path forward. The LGBT community grows stronger when we focus on our health. For me, that's it. That's what 40 Proud means. It's a powerful beacon that has kept us moving forward through many trials and tribulations. That core belief guided 4 University of Chicago students to form the Gay Medical Association in the mid-1970s. Student leaders David Ostro, Reed Solsky, Kenneth Mayer, and Mark Bahar joined other pioneering gay rights activists to form what would become the Howard Brown Memorial Clinic and later also the Center on Halsted. An unwavering belief in compassionate care for our community motivated Nancy Lemieux in 1990 to form the Lesbian Community Cancer Project, with fierce activists including Jessica Halem, Kat Jeffcoat, Mary York, Lisa Tona, and many others. LCCP took residence at Howard Brown in 2004 and became part of our family in 2008. With our very lives on the line, Howard Brown built medical and policy capacity to fight AIDS and grew an institution in its wake. The charge was led by people like Steve Wakefield, a volunteer in the late 1970s who would later chair the board, executive directors Harley McMillan, Judith Johns, and Eileen Durkin, who expanded medical care, education, testing, and research programs, and also served as pioneers for creating this, the Brown Elephant, and the campaign to give Howard Brown a standalone home at 4025 North Sheridan. People like Paul Lutter, who led the capital campaign to build a freestanding building. Roger Brown, whose grand mosaic welcomes our patients. Doctors David Blatt and David Moore, who brought their medical practice to Howard Brown. And Lois Bates, who spearheaded our transgender program. Where the needs demanded it, Howard Brown turned to partners. In 2004, Howard Brown joined forces with Children's Memorial Hospital, the Night Ministry, and Teen Living Program to launch the Broadway Youth Center. Joe Hollendoner, Rod Garofalo, David Myers, Barbara Bolson, and many others cared enough to take a stand for the health, wellness, and future of homeless and LGBT youth. The list of our past leaders and collaborators is vast. We stand on the shoulders of tens of thousands of pioneers who gave of their hearts, their minds, their wallets, their time, and their talent to advance the health and welfare of our community. For too many, their time on earth was cut short. We have the privilege to care for them in their hour of greatest need. Commemorating 40 proud years demands that we honor them, not just in words, but in our actions and deeds, securing a better future for the diverse LGBTQ community. 2014. In 2014, I joined Howard Brown, and it's been an amazing, amazing journey. The people, the programs, the passion inspire me, and I hope they inspire you. The organization is a hub of activity. It's humming literally 24/7. It's an institution that never rests. In fact, as we gather here tonight, our linkage of care team, our clinical staff, our patient service representatives, our sales associates, our facility staff, our prevention workers, our youth development team, and many others are hard at work delivering the various services we will discuss tonight. Please join me in a round of applause for the valiant and committed staff of Howard Brown. Here are 4 proud accomplishments we made in 2014. Number 1, we served more people than ever before. In 2014, our patient base expanded by 25%. With no advertising or concerted campaign, more than 1,700 new patients turned to Howard Brown for their primary care. Most new patients, that's great. Most new patients arrived without insurance. We helped them explore their options and assisted hundreds in gaining access to public and private insurance. Since 39% of our population is uninsured, we spent nearly $1 million to subsidize their health care. In 2014, our primary care numbers grew, but so did our PrEP clinic, which today is helping more than 500 patients prevent HIV infection with a daily pill. The cutting-edge therapy is called pre-exposure prophylaxis, or PrEP. Our screening clinics for sexually transmitted infections also serve more people and broadened its focus on viral hepatitis. In 2014, we tested more than 4,000 patients for hepatitis C virus. That's a 200% increase in screening against our 2012 figure. As a result, 91 patients now know that they are infected with hepatitis C, which can cause advanced liver disease. Armed with this information, our patients can benefit from the experienced clinical team at Howard Brown to carefully monitor their infection and, if needed, control or even cure hepatitis C infection. For patients testing negative for hepatitis, we offer education and vaccinations for hepatitis A and B. Accomplishment number 2, Howard Brown took extra care in 2014 to connect with our communities. We hosted town hall meetings to invite community members to share with us their needs and health concerns. Our trans health program grew by leaps and bounds thanks to a twice-monthly drop-in inaugurated in 2014. At drop-in, we offer no appointment medical visits, group services, food, and other activities. We are so proud that more than 1,600 trans-identified patients choose Howard Brown as their primary healthcare provider. Another important way that we connect to the community is our Community Advisory Board. The CAB, as we call it, is comprised of 11 passionate volunteers that represent all parts of our agency. In 2014, the newly formed group selected 3 initiatives to make Howard Brown a better place for patients to receive their care. The CAB is working closely with our staff to evaluate our PrEP program, to assess our linguistic accessibility, and assist with our march towards patient-centered medical home accreditation. In fact, thanks to the CAB, later this week, Howard Brown will submit its application for patient-centered medical home accreditation. Number 3, in 2014, we took concrete steps to improve our infrastructure for continued growth. I know that doesn't sound very sexy, but it's critically important. For example, we commandeered the atrium in our Sheridan Road clinic to create a new waiting room experience. No longer will our patients wait for services in a crammed, windowless room. Now they bask in natural light, next to one of the finest pieces of mosaic art in all of Chicago. The subtle yet powerful change has transformed the clinic and lifted everyone's spirits. We pride ourselves in delivering care that upholds the dignity of each and every one of our patients. Dignifying our patients begins immediately when individuals walk through the door. Checking in for appointments in Sheridan has also become easier, faster, and more private thanks to a new registration station. Even calling Howard Brown has improved. We created a 4-member team to start a call center that is now fielding up to 20,000 calls for services and appointments every month. And in 2014, we invested in our talented staff. We improved our benefits package. We raised the minimum wage, a change that was especially welcome here at the Brown Elephant. And we're taking other measures to offer professional development, advancement opportunities, and accolades for our most valued resource, our dedicated and skilled workforce. Number 4, perhaps our greatest source of pride in 2014, Howard Brown became a stronger nonprofit. Thanks to the resilient staff, a surge in new patients, and new insurance options available to our patients, we're on a solid path towards future growth and long-term sustainability. No surprise to anyone in the room, that's not always been the case. We started 2014 with unpaid debts to the federal government and Northwestern University, a mortgage in forbearance, a folder of unpaid bills, and hundreds of thousands of dollars owed to us from government funders. One by one, we tackled each challenge. We struck a 10-year settlement agreement with Northwestern, and we refinanced the mortgage. We paid off the feds. That was the first thing we did. And slowly, we whittled down our unpaid bills. After covering our costs, we initiated a careful plan to build a reserve fund equivalent to 90 days of operating expenses. 90 days is a standard for financial stability among nonprofits. Now, it will take us some time to get to that goal, but I'm thrilled to say that we're already a third of the way there. Make no mistake, caution is our friend. We will continue to manage our business frugally and carefully. We're mindful that healthcare is a volatile, competitive, and rapidly changing environment. And as you heard from Duke, nonprofits are especially exposed to capricious government agencies. But for the first time in many years, Howard Brown is setting its sights on growth and thinking about how to improve our impact on the community. Which brings us to 2015. Here are a few of the ways that we plan to advance the mission in the year ahead. Number 1, research. Thanks to a grant from the Alphawood Foundation, thank you, Alphawood, we are partnering with the Center for Gender, Sexuality, and HIV Prevention at Lurie Children's Hospital to expand LGBT-focused research among adults and adolescents. We could not be happier to have Lurie's staff advising us in this area. Lurie's has a long history of collaboration with Howard Brown, and this project is likely to spark many new research ideas aimed at improving services for our clients. Rebuilding a research portfolio is an important goal. We are thrilled Lurie's will provide us with the technical assistance and support to deepen our bench in this important area. Number 2, this year we are making all sorts of improvements to patient and client services. In the summer, we plan to extend our evening hours, Monday through Friday, and ensure that at least one, if not both, of our clinics are open every Saturday until 3. We're going to be rolling out a new sliding scale fee structure for STI HIV walk-in clinic. The walk-in clinic is a chance for individuals to get a whole bank of STI HIV screening services on demand. But the cost of that service is a fixed $95 for the full battery of services, which for many of our patients is too high and they can't afford it. We'll be rolling out a new sliding scale fee structure, much like our primary care sliding scale fee, which allows individuals who are low income and have documentation of their low income to pay at a rate that's reduced. This way we can make sure that nobody goes without vital STI HIV screening services. And just last month, we rolled out a new medical legal partnership working with AIDS Legal Counsel and the Legal Assistance Foundation. Now we're offering legal support 1 day a week in the clinic. And you might be thinking, what does legal have to do with clinic? Well, for so many of our clients, there are legal obstacles around housing, around benefits, around other issues in their lives, prevent them from getting into care or staying into care. Now we can offer legal assistance in the convenience and at the same time as when they come in to see their physician. Number 3. This year we're going to give some tender loving care to the brown elephant. We are so grateful for the loyal shoppers and donors who supported the move of our flagship store from Halstead here. And I don't have to tell you what a wonderful experience it has been to be in this wonderful new location. So inspired by what we pulled off here, we are going to do a full makeover of our store in Andersonville. It's time. We've seen the payoff. Looking at comparing our metrics from Halstead here, we're seeing an increase in donations and an increase in sales. We're going to evaluate, in Andersonville, we're going to evaluate everything from the lighting, the layout, the merchandising, the signage, even the bathrooms, to make sure we can provide the best experience possible to customers and donors. We're so happy to announce that Kit Rodriguez of Kit Rodriguez Design has agreed to donate his services to make this project possible. Stay tuned for rededication of the store later this year. And finally, we're announcing tonight plans to build a permanent home for the Broadway Youth Center. The Broadway Youth Center is an oasis from the harsh realities youth face daily living on the streets. Since 2004, BYC has provided an array of vital services for LGBT and homeless youth ages 12 to 24. Our incredibly dedicated staff provide a full continuum of comprehensive services. Everything from day respite care to food, group services, individual counseling, HIV/STI screening, laundry and storage assistance, case management, linkage to care, tutoring, GED programs, and other referrals. Without exaggeration, the Broadway Youth Center is at the core of the mission. Sadly, the program has had its ups and downs in the last 10 years of its existence. Most recently, the Wellington Avenue United Church of Christ and Alden Tom Tunney have heeded the call and allowed the program to operate from shared space in the basement of the church at Wellington and Broadway. We are so enormously grateful for the continued support which has allowed our program to continue uninterrupted. But unfortunately, the program requires more. More privacy, more autonomy, more space, and better facilities such as laundry, storage, and showers. Services that the church unfortunately cannot currently provide. It's time for the BYC to grow deep roots and a permanent home it can call its own. This is why today we're announcing the formation of a planning process to design the BYC's future home on the second floor of our Sheridan Road location. Now there's a big change for BYC, and it's a big change for the other programs and services we deliver at the Sheridan location. We will need to really plan this carefully because we have to get it right. That's why we're starting with the community planning process to inform the strategy and every detail of the plan to make this eventual transition a full success. The process will help us define how best to use the space we have for the BYC. Through the process, we will develop a detailed plan, a detailed time frame, a budget to ensure that BYC has all that it needs to increase its reach and impact. For me, there's no better way to commemorate 40 proud years than to begin the thoughtful process to secure a future for life-changing youth development work. We will need your help and your support along the way. And we pledge we will keep our many constituents informed of our plans as they take shape. Thank you so much for attending this evening, and thank you for your support for Howard Brown and our quest to make LGBTQ community healthier and stronger.